the shining light that we bear. We're the only ones to make her brighter, the only ones to make her better, the only ones.
From the band, Lalo and Samba.
It gives me great pleasure to be here to witness this very particular maternal, newborn and child health week flag off, which you have personally come to flag off by yourself. You will recall that the history of maternal, newborn and child health week started in 2010 as one of the recommendations of the National Council on Health. And since that year, we've been flagging off 2 times in a week. The aim is to support the health system, to improve on the health of women and children. And it also interests you to know that the Maternal, Newborn and Child Health Week gives us the opportunity to remind ourselves, and also for the government to showcase the initiatives and the policies they've brought out in terms of supporting healthcare service delivery. And Anambra State has always been known as a top performer when it comes to health. It's on record that in 2018 your state came first in terms of routine immunization throughout the country. And it's something that we are very proud of, and the partners working and supporting your state are very proud of the achievements of your administration in terms of primary health care, in terms of routine immunization, in terms of supporting health sector reform. I also want to commend your administration for being among the first states to launch the health insurance program, ASHA for short. It just demonstrates that your administration is reform-minded, and your reform-mindedness in the health sector has given rise to that particular agency, which is capable of covering all the Anambra in terms of providing them with health insurance. I want to continue to encourage you to continue to support that agency. We also want to commend you for being able to not only establish the Anambra State Primary Healthcare Development Agency, but also following it up with the board. The board is the governance structure for any government agency, and you have proven that it's not just in words but in actions by also appointing a board that is supporting that agency. That also shows that your administration is interested in building the institutional structures that are essential for us to build an enduring and a sustainable health structure for our people. And lastly, I also want to commend you for the Basic Care Provision Fund. That fund is capable of bringing sustainability to our primary healthcare delivery system, because it provides that institutional support in terms of funding mechanisms for our primary healthcare development, for our primary healthcare system to function even beyond your tenure. And fourthly, I also want to thank you, especially for coming yourself to grace this occasion. It also adds to that strong political will that your administration has in lifting and helping Anambra State to become among, to sustain your performance as one of the top performers in terms of healthcare indices. I want to especially also tell you that as we mark this Maternal Neonatal Child Health Week, the state is also embarking on other health programs, of which the State Ministry of Health and the agency and the partners are already supporting the state. We are already planning for, the state is already planning for the integrated A yellow fever campaign. We are also planning for the NIDs, that is National Immunization Plus Days. And the state has also done well in terms of efforts for polio eradication. We are in the middle of an outbreak response, and we want to thank your administration for all the support in this regard.
Me great joy to welcome you to the flag-off ceremony of the second round of 2019 Maternal, Newborn and Child Health Week, MNCH Week, which started yesterday and shall last for 6 days. It will be observed in all primary health care centers across the state. MNCH Week aims to contribute towards improving the health status of Nigerian women and children by increasing coverage of key maternal, newborn and child health interventions by 50% of the current indices in 2020. We are all happy to note that Anambra State has always participated fully in this national program that holds twice a year. Interventions given during the week include nutrition screening, mid-upper arm circumference, the MUAC, vitamin A supplementation, birth registration, family planning, the long-lasting insecticidal treated nets, deworming, antenatal care, iron folate, tetanus toxoid vaccination, SP for malaria prevention, sulfadoxine pyrimethamine, health education and sensitization on key household practices, especially hand washing, routine immunization, oral polio vaccination, yellow fever vaccination, and the rest of them. These commodities, which are given free of charge, have been distributed to all primary healthcare centers across the state to ensure full implementation of the week. We wish to note, Your Excellency, that under your able leadership, Anambra State qualified as one of the states in the Federation to participate in the first phase of the rollout of Basic Healthcare Provision Fund. Among the criteria for selection is that Anambra State has a functional state primary healthcare development agency, as well as a functional state health insurance agency. This fund, which amounts to 1% of the consolidated revenue of the Federation, shall be shared to states for primary healthcare activities using the one PHC word per word approach. We have just concluded training for business plan development for the OICs of the PHCs and the ward development committees, WDCs, of the 330 wards in Anambra State in readiness for actual fund disbursement next month. Because if I don't remember the flag of ceremony, Davido Maternal, Newborn and Child Health Week. If I remember, and na the whole 21 local government areas. If I remember, Maternal, Newborn and Child Health Week. Nizuka nine, onye bia na health center. Oye weekend inwete nine ifeni na ineku makiata. Vitamin A supplementation. And umwaka ine nanya but ndi dona 0 to 59 months. That is under 5 years. Even at this age group, immunity hana diba low. So we do all we can to make sure na a boost to their immunity. So this week they will come, immunization fanine according to schedule, and vitamin A supplementation. Then they will also receive deworming tablets. Twice in a year, every 6 months. otu akwa ụmụ nwanyị dị ime anyị ga-enyefa fesolate iron tablets nyekwafa folic acid mekwafa antenatal care nyekwafa net maka igbochi anwụnta ọya ịba ọya malaria ife a niile ka anyị na-arụ aka na-akọwakwalụ ndị mmadụ ndị bịa n'oge unu ya anụ ka anyị na-akọwasị ife dịsị iche n'iche anyị akọwago maka nutrition ụdị.
In November 2019, in faraway Seattle, Washington, the Bill and Melinda Gates Foundation and the Dangote Foundation hosted the Nigeria Governors Forum and then came up with a declaration called the Seattle Declaration. Your Honorable Commissioner for Health was invited to Abuja last week with other commissioners for health across Nigeria to discuss the contents of this declaration. We were onboarded onto that declaration, the contents of the declaration. And that declaration actually addressed primary health care under one roof. It encouraged the governors of Nigeria, the state governors, to try to adopt the spirit of PHC under one roof, and also immunization. During that conference, what came to light was that Anambra State happens to be one of the states that have actually achieved that. This shows stellar leadership, and we are happy for that, Your Excellency. Thank you very much. Also, the Governors Forum articulated their healthcare agenda under 3 pillars: nutrition, immunization, and kicking out polio by June 2020. Coming down to Anambra, during our discussion, one thing was equally crystal clear, that the roadmap to achieve that has already been laid out by the leadership of His Excellency. So it made me to stand shoulder high among my peers. And I said, thank you, Chief Dr. Obiano, for making my job easy. So discussed, and we were among those blazing the trail. Let's clap for His Excellency for that. Now, during that interaction, we realized that some of the things that are already being discussed, there are things that we've already done a lot of. And we've shown enough commitment to make that happen in the state. Why am I discussing Basic Care Protection Fund when we're talking about immunization? The reason is actually, if you understand the Basic Care Protection Fund, once that comes to Anambra State, what it means is that every child under the age of 5 can walk into a facility like this and get care free, the basic minimum package for health. What it means is that every pregnant female will walk into a facility like this and get seen without paying anything. What it means is that every Anambrarian can go into a facility like this and get their blood pressure and blood sugar checked periodically without paying anything. And this is because of the leadership of the Executive Governor of Anambra State. I say thank you for that. Now, looking at nutrition, the indices we are posting in nutrition still runs very high, and we're working hard to see that we are able to attract partners in nutrition. In a week like this, the MHC HW Week, the Maternal, Newborn and Child Health Week, is a week that helps us see that we sustain the milestones that we've already achieved in immunization and maternal and child health services. We want to keep our number in infant mortality rate very low. We want to keep the numbers for maternal mortality rate very low. During our budget session last year, and from His Excellency's, the discussion we've had, we are working as a state to see that the hard-to-reach communities in Anambra State will get coverage immunization-wise, and also when it comes to maternal mortality rate, that the number will be decreased. And that is why we are exploring the drone drug delivery services for the hard-to-reach communities in Anambra State. If that happens, it will serve our people very well, and this will be the first place in Nigeria in which that this kind of services is provided. Your Excellency, Through your support, we've maintained a leadership position in immunization in Anambra State. All we're asking our members in the community is to make sure that we avail ourselves of the opportunity that's being provided. Bring your children in for routine immunization, and during the National Immunization Plus Days that's coming up, that we're flagging up today too, we will need you to allow our immunization officers to access your homes so that they can give their children that are between the age of 0 to 59 months old the oral polio vaccine, because we don't want to be the ones that will mess up the numbers for other people in the country. We want that by June 2020, we join the League of Nations to say that polio has been stamped out eternally in Nigeria.
Pleasure, ladies and gentlemen, to be at Akpo, a village in Agwata local government, to flag off this year's Maternal Child Healthcare Week and the Immunization Week. Two things we are doing today, and if you listen to what has been said by I want to especially recognize the World Bank agent. It's because I'm sitting here, I'm not seeing you now. I thank you for your kind words on Anambra State. Thank you very much. And we will surprise WHO further by the kinds of things that we are doing and will continue to do. We took a major surgery in our health system when we took over in 2014. We identified that forming a primary health care agency will assist immensely in taking care of those first level requirements in treatment, and we have not been proven wrong at all. With the able leadership of Dr. Enimu, we have done very well in this area, to the extent that we are about to assess the basket of funding that the federal government is about to share to the primary healthcare agency. On our own, since 2014, we've renovated over 250 hospitals. We still have about the same number to touch again. And beyond that, we've also made it possible that immunization in a very conducive way reaches the people in the very hard to reach area, in the riverine areas. We bought 21 speedboats, which has been very helpful. That was one of the reasons why we scored #1 position in Nigeria, according to the World Bank fellow last year. And we want to maintain that. You can see the personal interest the governor is showing in this program. That's why I felt that this is important enough for me to be here personally and to flag it off, because it will help. This week you are supposed to, all the women that put to bed and their children are between the ages of 0 from date of birth to about 59 months. Is that what you said? Yes, they are supposed to go to any primary health care and get a free medication. Very important. So they will give your child what will make your child a better child when he grows up. So all the fact that you do that. If you miss that opportunity, you will regret it all your life if your child picks up a disease that ordinarily should have been taken care of at this primary stage. So I encourage every lady that put to bed, and parents generally, let the male folk also take interest in what their wives are doing and make sure that their children are immunized. And today I will do the oral, what do you call it? I will administer oral polio vaccine to our people. I want to put it on record that since 2014, we do not have a single case of polio in Anambra State. That is correct. And WHO will confirm that. That is due to both the effort of the previous administration and my effort. So So we don't have a single polio challenge in Anambra State. But having said that, it is important that we continue to do the oral polio administration because it will further help boost the immunity of our immune system of our young children. You know, so I really would like to flag off this 2020 week. You know, and as we are doing it today, it's being done in all the local governments by the chairmen of various local governments, you know, and that shows again the importance. You know, we are ready for you. We have refrigerating equipment that we have installed in the 8 water balances that we bought 2 years back to assist in this kind of assignment. So the medicine you're going to deliver in faraway places like Obaru or Iziagulotu will be in a very good condition because it will be preserved in the manner that has been prescribed for that preservation. You know. So on this note, I want to thank Ndiakbo and encourage you to for your primary health care center. You know, so your child will be taken care of. It is very important that we do so. APGA APGA APGA. I also want to encourage Ndiakbo that have not joined our health insurance scheme to please do so. So 1,000 naira every month. No matter the amount, government the insurance scheme are quality over. So why not join it? In a check you go there where you join. Okay, doctor is doing for bill or February. So join 1,000 a month. Then you will be taken care of, even surgery or what have you. You will just take care of you. Please try and do so. Very important. And let me use this opportunity to emphasize adequate care for prevention of Lassa fever. Even a kitabu or coach ana abofioku, ana abofioku, or kedina and megini, or na baputa, a bekona baba. Obviously, but to obey or batanona, more legal ceiling. You know, so Gary, my rice wouldn't only go to plastic and when I maybe not put here, so that all your mammy the boy also, or my baby, on my phone, and you say, they put a lesser figure of water. And or they are put up on their cocoa, on your banana, man, let the Golia Eguna. So, all the banana, I prevented it, and we can prevent it. Okuna even so, we will a cocoa again, Garibo, one your bona. Only silly lopota or quachakia before by no. Each if a quachakai of my, even if you are using cutlery, a quachakai of my before you really leave okay with incha. What I say, I can't the compare. You know, if you do all those things, you would have saved yourself, your immediate family, and Nigeria as a whole a challenge. Because one Lassa fever can cause an epidemic. You know, so I actually call Obiano Anambra, Chukwemego, Oderia. Ndine okay, because no, everybody is not okay. America,
flagging up the Maternal, Newborn and Child Health Week. That's one and okay, see from Ebana Waka, Nana, if you need me, you don't let him a man, we fed but the women, they will not have this
fears. Leads